Hey and welcome to this week's 5-minute physio tip. I'm David Pope from Clinical Edge, and today we're going to be having a chat about manual therapy, fantastic or horrendous. I'm going to be discussing this from the point of view of the research as well as my own clinical experience, because at the moment there's a fair bit of debate going on in the physio profession as to whether it's a good direction for the profession to take to be performing manual therapy, whether it has any value, and whether we should be just performing, giving people exercises rather than a passive treatment. They're good questions and they're definitely worth thinking about. So the anti-manual therapy group tend to have a number of different points, all of which have value. So the general points of view are that manual therapy is a passive approach. So you're making the patient potentially relying on you as a therapist to get them better. So they think that they're not getting themselves better, but they need you. The second one is that you're wasting valuable treatment time performing manual therapy when you could just be spending that time performing exercises. The third argument is that the specificity of manual therapy doesn't really matter, that you can push anywhere and still have a bit of a pain relieving effect, and so you can just be pretty non-specific and still get a medium result if you are going to perform manual therapy. So they're the main approaches. People also look and go, well, if I've got 6 treatment sessions, how much of that should I be spending on manual therapy? Do I need to just get them in, get through their exercises and get them on their way? Like I say, they're all great points. They've all got a lot of value. But we're going to sort of talk about when those points of view make a lot of sense and when there is a role for manual therapy. So manual therapy as a passive intervention, I think that's the first one to address. And I think it's a really good point, because if we only perform manual therapy on a patient, that's all we do, then it potentially has the role of making the patient reliant on us as a physiotherapist, thinking that we're the ones that are getting them better. The thing is, though, if we can actually address the patients with our language and think about how we're communicating with our patients about what we're doing and how the treatment effect works, then we can make it a bit less about what we're doing and a bit about enabling their body to get them better. So we can pretty much have the same effect of reliance with an exercise as well. So if you tell the patient, here's your exercises for this week, you're going to need to come back and see me to get the next stage of your exercises, otherwise you won't be getting better. You're also creating a bit of reliance on the next exercise step. And it's a good point. The patient often do need those stages in their exercises to get better. But we can sort of look at upon that as a bit of a reliance inducer as well. So with your manual therapy and your exercises, I think a lot of it actually comes back to the language that you're using with your patients. Are you describing this as something I'm doing to you that's making you better? But you can describe your manual therapy in terms of you're enabling the system to work or their body to work better. You're enabling movement in a number of joints that are restricted, or muscles, or however you want to describe it, so that you can enable their body to move better and feel better. You can also point out to them that this isn't just going to fix their problem, that they are going to need to do exercises as well. So you can tie it into that active approach as well. And I think that's really where manual therapy has a role. It's not just about getting them in there, pushing on some sore joints, doing some soft tissue release. It's about making sure that they have got something that they're working on in between each of your sessions. And that might be some manual therapy on themselves, some self-releases, or it could be some motor control, some strengthening, changing their loading patterns, all those larger aspects of their management that you are going to incorporate anyway. So language is the most important factor when you're looking at manual therapy or exercises, and probably makes the biggest difference overall as to whether your patients get better. The other things are, is it a valuable use of our time to perform manual therapy in your session, or should we just be performing strengthening or other exercises? It's a good question. And if you're spending your entire session just doing soft tissue release or manual therapy or whatever, then it's quite likely that you are wasting the patient's time. But like I said before, if you can tie in some manual therapy, and it might be just 5 minutes of manual therapy, up to 10, whatever you've got there, but not the whole session, enough that you can have an immediate change in the person's pain and range of movement, and you can have a demonstrable effect on their functional movement that they're interested in. You've then got some support for your manual therapy, and it's easy then to progress into your exercises. You're going to get a nice buy-in from your patients. The patients are going to be more willing to perform the exercises if they've already seen that you can make a difference to their pain, and you can have that effect really quickly. So I think when you're looking at whether to do manual therapy or not, that's the most important things. Are you, A, getting change in their pain and range of movement immediately, or are you just doing some manual therapy and hoping that it works? If that's what you're doing, then you probably should try and be more specific with your manual therapy, or give it away. So when is manual therapy horrendous? When shouldn't you perform it? Well, I think there's a number of different scenarios where it's a complete waste of time and you really should just be focusing on other things. So number one is that you're not having an immediate change and a sustained change in their range of movement and pain. So you need a within session change immediately from performing a short amount of manual therapy to know that you're on the right track. So for instance, if you've got someone with painful neck rotation to the right and you're just doing some manual therapy on that painful joint, well, number one, I think that doesn't make a lot of sense anyway, just pushing on the painful joint. But B, if you've reassessed them after a minute of manual therapy and you've made very minimal changes in their pain and range of movement, you're wasting your time. So don't just bang on that joint, go, I think we just need to do some more on this. Stop and either reassess or take another approach. So that's the first case where manual therapy is a waste of time. Secondly, and I sort of touched on this, if you're just pushing on the sore point. Once again, it's a ridiculous approach to just find the sore point and bounce up and down on it and think that that's what's going to fix the person. You might have a short-term neuromodulatory effect, some minimal changes in their pain and range of movement from just pushing on the sore point, but realistically, you haven't changed what's going on that's caused that problem. You haven't addressed any of that. All you've done is just poked and prodded the sore bit. So that's ridiculous. Thirdly, if you're just doing soft tissue release, soft tissue massage on a sore area or something you consider tight, once again, that's ridiculous. You need to be finding some muscles that within your clinical reasoning you've identified as maybe causing that restriction in the person's range of movement, and then addressing that. So if you've got, like I mentioned before, someone's got hamstring pain and you just rub their hamstring, that's just a waste of time. So don't waste your time just rubbing the sore bits or going, you've got some back pain, we need to massage your erector spinae. That's just a waste of time. One of the other times when it's not valuable doing manual therapies, if you've got some widespread central sensitization. So you've got those people that we're going to talk about this in a future 5-minute physio tip, how you can recognize them, but you're probably picking them up. They've got a bit of pain everywhere. They've got hypersensitivity to cold. It's maybe hyperallodynia. A lot of those things that we're going to talk about in future episodes to pick up, but central sensitization, you're not going to have a great effect. You're probably just going to wind them up, especially if they say, my pain feels worse when it's a cold day, and it's cold. You're definitely going to have a negative outcome on those days. System's already wound up. Don't waste your time. So I hope that's helped you identify that manual therapy can be fantastic. It can also be horrendous. There is a time when manual therapy is incredibly valuable for you, and most importantly for your patient, because that's what it's all about. It's about helping your patient get better as quickly as possible, and manual therapy can assist if we do it right, we talk to our patient right, and we use it on the right people. So that's all for our 5-minute physio tip. We've probably run a little bit over 5 minutes, but I hope you've enjoyed it. And in our next episode, we're going to be talking about the sort of patients that can benefit from manual therapy, and we're going to talk about the types of manual therapy you can perform in future episodes. I'll give you some tips on those as well. All right, thanks for that. I'll see you in the next one.